This is a public service health announcement for the state of Florida in remembrance of HIV and AIDS Awareness Day, December 1st. HIV and AIDS has been a serious pandemic for more than 30 years and still remains a serious challenge globally. Unfortunately, the rates for terminally illnesses and diseases like HIV and AIDS can have a high distribution rate based on an individual's geographic location. Southern states like Florida has accumulated high HIV and AIDS transmission rates in 19 to 25-year-old adults. However, as of now, there is an extensive research that presents the demographics and the rate of submission of HIV and AIDS. But there is also a lack of information as to why this is occurring. According to the Centers for Disease Control, in the year of 2015, the state of Florida ranked at number 3 for the highest diagnosis of HIV infection. Two organizations I've contacted in reference to this topic are Advocates for Youth in Florida Health Department. Understanding why a southern state like Florida is heavily impacted by this disease will help implement new approaches in lowering transmission rates. Advocates for Youth is an organization that advocates for policies and programs that promotes young adults' right to sexual health information and also provides accessible, confidential, and affordable sexual health services. According to the Advocates for Youth, 41% of new HIV infections occurs among young people, which means that every 30 seconds a young adult is infected. During my research, I got the chance to speak with Natalia, whom is an activist for Advocates for Youth, and an important infraction that Natalia shared about the organization's research thus far is that southern states accumulate high HIV and AIDS rates because of the hot climate, and individuals living with HIV and AIDS are likely to move geographically at least once in their lifetime. Another organization that was involved in my research was the Florida Health Department. While some might know, the Florida Health Department tirelessly works to protect, promote, and improve health of every individual in Florida. An interesting program the Florida Health Department facilitates is the HIV and AIDS Surveillance Program. This program helps the state determine HIV resource needs, program planning, and evaluation. To help ensure the statistics of HIV are not skewed, the surveillance staff conducts data validation checks to ensure cases are not reported twice within Florida or to the CDC's national database. The reason why this is so important is because HIV is a chronic disease and infected people may be tested frequently as a way of monitoring treatment success. This can somehow contribute to why the rates of HIV and AIDS are so high in southern states. The source of action to combat this issue is to first educate the public of the high rates in southern states. Alarming the public, mainly young adults, on how close they are at risk for HIV and AIDS can serve as some sort of mental stimulant that can help remind these individuals to practice safe sexual activities. Regardless, people are always going to have sex. Therefore, implementing more programs or drives that teaches and provides medical services with an upbeat and non-judgmental environment can help eliminate the barriers southern states largely face. A great social media outlet to bring more awareness in regards to this topic is Snapchat. Snapchat is one of the most used social media outlets by young adults today. Additionally, the short video feature and filters will keep this audience engaged and well informed. Together, we can combat this health issue. For more information, please visit floridahealth.gov and advocatesforyouth.org.